Joining us now is Raymond Powrie. He is the Executive Chief of Medicine for Care New England. Ray, thanks for joining us today.
A pleasure.
So let's talk about elective surgeries here at Care New England. Everything has reopened. How are things going?
Extremely well. We're very excited to see that actually we are able to provide exceptional care in a safe way in the context of the pandemic, and that our patients are trusting us with that.
What have we learned since COVID? This is a novel virus. We must have learned a lot about healthcare, how to treat patients. Can you talk a little bit about that?
Well, I think, unfortunately, of course, coronavirus, COVID-19, has been a major devastation for the United States, for the world, for many families. And so I do not want to at all minimize its impact. But like any challenging situation, there have been very significant opportunities and learnings that I think have benefited us greatly as well. So the proverbial silver lining to the cloud. And some of those things have been that we actually have understood differently and in a better way how we can protect patients and our employees in the context of infections and make healthcare environments safe. I think that the use of things like hand hygiene, social distancing, masking that we were always aware of, I think we never fully understood what incredibly useful and powerful tools these are. I think we've also learned new ways to what we call cohort patients, to have patients separated based on their needs, so that a patient who's coming in with chest pain doesn't necessarily need to be put beside someone who's having cough or fever. And even in our emergency rooms, we do things differently in that regard. But even in our offices, the way we schedule, where we send patients, how we triage patients, how we sort those needs to make sure that there are not unnecessary exposures going on to other patients or to our staff has been a major step forward. Another important thing is just how we cleanse and how we use disinfectants. The disinfectants that are commonly used seem to be very powerful for the virus. And we've put in new protocols in place to make sure that every surface, every doorknob, every place a person might touch is regularly cleansed, so there's no risk that surfaces might transmit the virus. And so we're excited about those things. I think the other major difference that has been a real boon for us has been the use of telemedicine. The opportunity not to have to get in your car, drive, find parking, get to the appointment, feel all sweaty and hot to do so, and have a discussion with your patient and then find your way back. The idea that we can just pick up the phone and connect with our doctor just the way you and I are connecting right now, Raina, has been transformational. It's been a pleasure for us to be able to provide that kind of access, and we're not planning to go back from it after the pandemic, because we think it just enhances people's access in ways that we never thought. A mother at home with 3 children, an elderly person who feels frail or uncertain about their transportation. The ability to connect through the phone or through the video has been powerful. And although there are still times we need to see people in person, it's been transformational to realize how often this kind of connection can get 90% of the job done safely.
So should this virus come back, let's say in the fall or at another time before we have a vaccine, you're saying we are ready?
Absolutely. The virus isn't gone right now. The virus is out there. It's amongst us. And so that it may surge again, depending on how carefully people follow the rules that have been put in place and the recommendations from the state and from the CDC. But I think that we have absolutely understood through the American pandemic in new ways, the ways that we can prevent transmission. And I feel that people should come and seek their health care. I think we're all concerned that people being worried about their health care may mean that they be mistakenly avoiding health care because of risks that don't exist right now, because we have changed the way we do things so much, and that they may find themselves susceptible to other potential risks like missed heart disease or missed cancers or following up with their diabetes that is so essential to their ongoing health. And so, of course, there is going to be some risk about coronavirus for the months ahead. But I think we're got that under control. It's time to get the rest of our healthcare needs under control.
Raymond Powrie is the Executive Chief of Medicine for Care New England. Ray, this was a wonderful interview, and thank you for sharing all this wonderful information with us.
Always a pleasure to work with you, Raina.